Good morning, everybody. Good morning. Good morning. This does not happen in our routine life where everybody responds back when we give lectures for physicians and doctors. But thank you very much for making time this morning on a Saturday to be here. My name is Arvind Bhimaraj. I'm one of the heart failure cardiologists at Houston Methodist Hospital. And on behalf of all the staff at Methodist Hospital, including my physician colleagues, our nurses, nurse practitioners, our psychiatrists, our palliative care doctors, and some of our patients who have helped put this conference together, I extend a warm welcome for all of you to be here today. Thank you. We will go over certain specifics of why are we really here today and why should we be spending a Saturday while you can be at home on a cloudy Houston day. You can relax and watch TV in bed. But the reason why you're here is in one form or the other, your lives or your loved ones' lives have been affected by what we term as congestive heart failure. And it's across the country, it's a problem. It's a problem for the health of our nation. And it's projected more than 8 million individuals will get affected with what we call as congestive heart failure by 2030. And across Houston, if you do the math, it comes out to be more than 250,000 individuals who might currently have the diagnosis of congestive heart failure. So, why should we care? There are so many other health problems in the country. There are so many other issues that individuals are facing. The importance of individuals taking control when you're inflicted with this diagnosis is being learned more and more. And our team, our institution, fortunately, believes in that basic tenet that as an individual, as a patient, you have to take control because there's only so much your doctors can do. Especially for conditions like congestive heart failure. So there are certain basic tenets by which we are trying to promote what we define as patient empowerment. This is not unique. This is across the board in many conditions. This is across the board in the world. But for congestive heart failure, we're proud to say this is probably the only conference like this in the entire world where we are able to engage the enthusiasm of individuals and their family members to be here to help us care for all of you. And trying to understand what the disease process is, trying to understand why any of you or your loved ones have gotten affected by heart failure. That's not easy. And through the day, we'll go over the format of what we're going to be dealing with. But essentially, we know that heart failure in the medical terms is actually has a classification of stages. And this is not that old. The system of classification was put forth probably in the last decade because the medical community realized that people are at risk. And if we avoid the risk, we can probably avoid the occurrence of heart failure. And that's what's called as stage A heart failure. Now, the problem with that, though, is that a lot of people are at risk for heart failure. Anybody who has high blood pressure is at risk of heart failure. Anybody who's getting chemotherapy agents for cancer is at risk of heart failure. So this mission, which we're hoping to achieve, is more focused on general community awareness, people who go to your primary care, who are young, who are healthy. How do you care for yourself to avoid it? Stage B means that you have some abnormality in your heart, which can be picked up by an ultrasound or by an EKG, but you're feeling perfect. This is the times when you go to your primary care doctor, they do an EKG, and then say, hey, something's wrong, I want you to see a cardiologist. Stage C is pretty much majority of patients who we see who come in with complaints. All it means is that you have some problem with the heart, and it's reached a point where you are feeling the complaints and symptoms of it, and that's how you come and see us. And of course, stage D which means that despite the best efforts of all treatments that you can, you end up reaching a stage where we call as advanced heart failure and end-stage heart failure. Why do you need to know this? Right? We're not going to be tested in any exams like the medical students that we teach them. But this is important to know because if you have congestive heart failure and you're sitting somewhere here, we want you and us all to work towards keeping you here. Once you have complaints related to congestive heart failure, you'll never go back here. It just means that you have complaints and the complaints go away. You will be still called as you're in stage C heart failure. It's just how the public health system has defined it. But the goal is to get rid of the complaints and symptoms and keep people here so that you don't get worse. These are all equal spaces, but essentially there's a long journey here until you reach advanced heart failure. Also, the goal is, if you're reaching advanced heart failure, a lot of times individuals lose hope. There's no other options. And there's a lot of technological advancements that individuals are able to replace the heart with transplants, with heart pumps. So as things are evolving, if you do not take control and take charge and keep yourself informed, sometimes it's not always feasible for all the healthcare providers to keep up with everything that they're doing. So essentially, our hope and goal is that as we move along, we give enough information for all our patients and their loved ones so that you are in control of your healthcare and not just relying on the physicians or the healthcare system. The biggest mistake as doctors that we've done for centuries is we have perpetuated the culture of writing a prescription and doing tests and then said, follow this. It doesn't work like that. It works like that if you have a back pain and you go to a chiropractor and they can fix it. It works like that if you have a problem like an appendix and you cut it open, take it out, and then you're done. But diseases like chronic conditions, diabetes, high blood pressure, congestive heart failure, you live with them. So following instructions is not equal to, I'm going to take care of this and control it along with our healthcare provider. And that's the philosophy that we want all of you to walk home today from here and hopefully change the trajectory in your journey with us. So essentially, the concepts that are perpetuating is understand your heart failure, identify your needs for your heart failure, and then explore the treatments as I had suggested in my earlier few statements. And we understand that it's not easy. One of the most complex conditions is congestive heart failure. It's a confusion heart failure is what we call sometimes as CHF because it has confusing terms. In the medical field, med students get confused. Even cardiologists who don't specialize in heart failure get confused because we have perpetuated terms which are historic. We say left heart failure, right heart failure, we say congestive heart failure, dilated cardiomyopathy, restrictive cardiomyopathy. And if you have seen any of these terms in any of your medical records and it's been changed from one doctor to other, it's not like they're wrong. It's just that this whole term has a lot of confusion in how the disease has evolved. And you're not alone in trying to deal with this. We always know you have your families, you have your caregivers, but the goal and hope is that we as healthcare providers want to be a part of this in helping you achieve this. All right, what is the source of information? How many of you go to the internet as your first resort? I do that too. All of us do. So there are a lot of sources of information. There are sources of information starting from what we call as Dr. Google, because everybody Googles information. You have professional societies, which is American Heart Association, American College of Cardiology, Heart Failure Society of America. There are a lot of healthcare professional bodies that can be your sources. There are support systems like Mended Hearts, your friends and neighbors, which are all categorized into these 4 sectors. So if you can use the poll that you just signed up to and pick which aspect do you go to get information about heart failure, A is the internet, B is the doctor's office, you call your doctor or your nurse, C is the professional organizations, and D is support groups. It's like the stock market. All right, so I think that's not surprising to me, where a big percentage of us in general use the internet. That's the way of the day today. But the internet does get overwhelming, even for scientific research, and how to sift around what is appropriate, what is not appropriate is always a challenge. And calling your doctor, 20-30% are calling their doctor for information, but how often do you get enough time to sit down, talk to them, and get some information about aspects beyond medical care? So these are all challenges that we appreciate. And what you notice is there's a 0 individuals who are able to use support systems. Why? Because congestive heart failure has not been organized the way the cancer world has done. The diagnosis of cancer is devastating, no doubt. But the diagnosis of heart disease, in my mind, is no less devastating. It doesn't mean that you're happier having a heart disease versus having a cancer. But if you look at the world of cancer is very well organized. There are support systems, support groups, people help out each other. And our mission and aim with this process is to see if we can get to that stage so that you can live a better life with this diagnosis. Identifying your needs. Do these apply to me? We already said that the diagnosis is confusing, and if there are 101 permutations and you don't know what you have specifically, then you don't know whether these apply to you. So it's important to have that engaging conversation for you as an individual of what kind of heart failure do I have, and we will provide some information as time goes by. And then explore your options. Why do I have to do this? Why do I take these medications? And through the day, we will talk about it. Medications, it's not just taking the medications and going home. You have to know why you're taking those pills. You have to know that you have to reach a goal. That's where I tell my patients, once if they have a new diagnosis, I tell them, you got 3 days to go to med school and learn about heart failure and come back to me. If not, we're not going to succeed. So if you're on your own, that's what you're left with. But our hope is that you don't have to go sign up for med school in 3 days, but we can create resources where you can become an equal partner in figuring out your management and a plan and an outcome. So it's a team. The team includes us as healthcare providers, including your doctors, nurses, in the offices that you're seeing your physicians. You are a part of that team, and you need to be empowered to do that. And it's not just taking control of your health. You take control of your health, but we want you to take control of your health care so that you can define on what you're getting, and you can define on making sure that you're getting the best care that you should. And it doesn't matter which physician you're seeing. Our goal is we don't want all of you to stop seeing your physicians and come to Methodist. There are a lot of good doctors across the city. But the healthcare system has not figured a way where doctors can spend enough time with you. No one has the time to sit there for half a day and give you tips how to live. And how often have you been able to talk to your doctor about, this is stressing my life out? This diagnosis has made it devastating. So what you are left to do is to compensate, because the healthcare system has not devised a way to do these things. And this is one way that we figured that if you come here on a weekend and spend a day where we can help you understand these things, you can go back to your doctors and be the team player that you are expected to be for all the physicians that you're seeing. And as you will learn, congestive heart failure comes in various forms. So you might be seeing a cardiologist, you might be seeing an electrophysiologist, you might be seeing an internal medicine doctor, you might be seeing a heart failure specialist. It depends on what your main problem is, along with congestive heart failure. So if you do not understand the things that revolve around congestive heart failure yourself, you might not be effectively contributing to the care that you're getting. And that's really the intent. There are many, many more patients with congestive heart failure than you can find specialists in heart failure to support the country. As I said, there are about 250,000 heart failure patients probably in the Houston area. There are not more than 70 heart failure specialists across Texas. And the specialties, to make sure you all understand, I mean, all doctors look alike. It's not like we're walking with a heart failure board or something. We're all cardiologists. After cardiology, some people spend 1 year specializing in putting in stents. They're the doctors who go in through the catheters, open up arteries, put in stents, and they're called interventional cardiologists. A lot of my colleagues do that. There are other cardiologists who spend another year learning about the electricity of the heart. They're called as electrophysiologists. They do ablations, they deal with atrial fibrillations. And there's another group like us who specialize in advanced heart failure. We spend a lot of time in mechanical hearts, transplants, and take care of patients who need our services at that stage C leading to stage D. So all of the people that I mentioned are essentially cardiologists. So we all can take care of a weak heart, but the tools you need to contribute to your care are probably what you need to make that relationship successful. And that's why we're here today. And not to forget the family and caregivers. This actually was just published yesterday. This was a study done in a few countries, 4 countries, where caregivers who are caring for patients with heart failure don't have enough resources. It's not easy to see your loved ones go through this, lose control, and not know what to do. And it becomes incumbent for us, if you need to be successful, we need to make sure your success system is appropriate. So there'll be a little bit of discussion today on the fact that we need to acknowledge this and the fact that we need to provide a system in which we can help individuals caring for our patients to be equally successful, to make all of us successful and caring for you. And we want to destroy the statement that heart failure is the end of your journey, right? The diagnosis comes with the fact that, oh, my heart's failed. It's going to stop. It's ended. And that's really not the reality. And through the day, you'll have opportunity to interact, that it's just a mismatch between your ability to pump blood in one form or the other, and your heart's not able to keep up with the demand. So the term is a terrible name, and we recognize that. Across the medical community, including heart failure specialists, we cringe when we say heart failure because it's not a hopeful term. It just is a historic term. And if any one of you can come up with a term which is better than us, I think we will be famous. We want the term not to say that we're going to fail. And our goal is really to take the failure out of heart failure and essentially talk about successful living. And I just made it up saying we'll call it heart dysfunction, It's just not functioning well. And maybe if all agree, we can put that recommendation for people to start changing the term. And a lot of patients have pointed that up. If you go to our top floor in our hospital, it says heart failure unit. And the first thing you see is failure. Failure strikes you in your face, but that is not the reality of today. Heart failure is a term which is centuries old, and it's probably time to change. Whether the term remains the same or not, we want to change the philosophy that you can have a successful life as long as we get the right tools for you. So the hope that today, when you leave, you're able to take control of your heart, you're able to take control of your health, but also take control of your care in such a way that you can live a successful life with our help and with your caregiver's help, and hopefully solve this problem of struggling with heart failure. We, as a medical community, there's continuing research that's going on in not just treating heart failure. We have a lab that across the country, there are a lot of labs that are working on how do we fix heart failure. Is it easy for me to snap a finger and put a gene therapy and things like that? We're working on it. But as much as it looks like we have so much technological advancements, the understanding of congestive heart failure is still very rudimentary. A part of it starts with the fact that the terms are confused. And if I take a pick of whoever here has congestive heart failure diagnosis, I'm pretty sure that everybody will have a different kind of congestive heart failure. So when we're trying to do research, how do you learn one from the other? How do we differentiate people from having heart attacks with high blood pressure? That's really where the research has lagged. But our hope for the future, if we succeed in our research, is that we probably can recover everybody, and then we don't have to have these conferences trying to live with heart failure, so we can eliminate heart failure. But that's a long journey. Until then, we're stuck with the diagnosis that we have to embrace, and once you embrace it, you conquer it, and hopefully we can get you the tools to conquer it and help you live better.